What's the difference between a root canal and a tooth extraction? And how does a dentist like me decide which procedure is best for you? Hi, I'm Dr. Priya Grewal and I practice in the Washington, D.C. area. Today, we are discussing everything there is to know about root canal treatment and how it compares to having your tooth extracted. Root canal treatment and tooth extraction are two very different ways to manage a severely damaged or infected tooth. Dentists often think about both options carefully before deciding which one is best, because each has its own benefits, risks, and long-term results. The goal in either case is to relieve pain, stop infection, and restore your oral health. But how that's done can make a big difference in the patient's comfort and future dental needs. And our job ultimately is to save your teeth. So why would a dentist even recommend you to have a root canal? Most of the time, we recommend root canals for patients when the pulp of the tooth is contaminated. The pulp, which is the deep layer below your enamel and your dentin, holds the nerve and blood supply of a tooth and communicates to the rest of your body. If the pulp gets inflamed or infected from deep decay, cracks, or trauma, it cannot be treated with a simple filling or other restoration. It's either a root canal or an extraction. If you are lucky enough to have enough tooth structure remaining, your dentist will recommend the root canal to save your tooth. During a root canal, the dentist or an endodontist, which is a root canal specialist, will remove the infected pulp, clean and disinfect the inside of the tooth and their canals, and seal it with a filling material. The main benefit of the root canal is that it preserves your natural tooth, keeps your bite and your smile intact, and prevents neighboring teeth from shifting. Many times, patients will forget which tooth has the root canal, as it feels and functions like your natural teeth. Patients also tend to report high satisfaction because they keep their own tooth without needing surgery or an implant. Keeping your natural tooth also helps maintain the gums and bone around the tooth, which shrink or collapse when teeth are removed. The long-term success rate of root canals is high due to the advancement of CT scans, microscopes, and ultrasonic disinfectants to aid in the microsurgery. The stigma of pain associated with root canal treatment is something of the past, as dentists are trained to use modern approaches with appropriate and effective anesthesia to ensure in our patients' comfort as our top priority. Many patients will often wonder what their tooth will look like after a root canal. In most cases, the outside of the tooth looks completely normal because the treatment is done inside of the tooth. A crown is usually placed on the outside afterwards to protect the remaining tooth structure, as the tooth is hollowed out, similar to an eggshell, and can break very easily. Crowns are highly aesthetic and are matched to your natural tooth color and shape. So from the outside, it looks just like a regular tooth. Crowns are a common dental procedure when there is loss of tooth structure, and many times, if the pulp is not affected, they're still recommended without root canals. In some instances, particularly on front teeth, if the damage is minor and the tooth structure is still strong, your dentist can restore it with a tooth-colored filling that blends in perfectly. Sometimes, over the years, a root canal treated tooth may slightly darken because it no longer has the blood flow. But your dentist can correct that with a procedure called internal bleaching, a veneer, or even a new crown. In short, a root canal treated tooth should look and function just like the rest of your teeth when it's properly restored. On the other hand, a tooth extraction becomes the preferred option when the tooth is beyond saving. The number one reason for extractions is when decay or a fracture on the tooth is so severe that the tooth can't be restored with a filling or a crown. In some instances, an extraction may also be necessary when infection has spread so deeply that it cannot be controlled, or when gum disease has destroyed too much bone around the tooth, where the tooth becomes mobile beyond repair. Unfortunately, there are times where patients choose extraction for personal or financial reasons, or if they just simply want a quick fix. The benefit of the extraction is that it removes the source of pain or infection immediately. It can also be less expensive in the short term. However, extractions create an empty space that affects chewing, speech, and appearance. Without replacing it, it can become a domino effect, as the nearby teeth can shift and move into the empty space, including the tooth above or below the space. The jawbone can also shrink, and the smile may lose its natural shape. Patients after extractions need a dental implant, bridge, or a denture to restore the missing tooth, which can add time and cost and doesn't result in the quick fix that they were looking for. Both treatments, a root canal and an extraction, carry their own risks. Root canals sound great, but can sometimes fail if bacteria remain inside the tooth or if the tooth cracks later. A small percentage of patients experience postoperative pain or swelling, and the success rate can decrease over time if the crown or filling isn't maintained. Still, studies show that teeth treated with root canals can last many years, being the most cost-effective treatment over time. Extractions also have risks, including pain, bleeding, infection, or a dry socket, which is when the blood clot dislodges and leaves the bone exposed. Complications are more common in those that smoke, diabetics, and people that have some surgical extractions. As we talked about before, losing a tooth can have emotional effects, especially if it's visible when smiling. Replacing the tooth with an implant or bridge usually restores appearance and function, but these options can be more expensive and require surgery and time. In the long term, both procedures can lead to a favorable outcome if managed properly. A tooth that's successfully replaced with an implant can perform just as well as one that was treated with a root canal. However, when an extracted tooth is not replaced, that's when we see more issues, and that's why dentists generally recommend saving the tooth whenever possible. An extraction can sometimes become the only option after we have exhausted all efforts to save the tooth. In summary, root canal treatment is best when the tooth can be restored, allowing patients to keep their natural smile and normal function. Extraction is best when the tooth is too damaged or infected to save, offering fast relief but requiring a replacement later for full function and aesthetics. The right choice depends on the condition of the tooth, the patient's overall health, and their long-term goals. I hope you found this helpful. If you have any questions, please drop them in the comments below.